Here at the Cincinnati Zoo, we pride ourselves with our natural exhibits and botanical garden. But if you look closely, of course, you can tell we are right here in the middle of the city. And our nearest neighbor is a good friend, Cincinnati Children's Hospital. Over the years, they've helped us with all kinds of animals that need either special care, special diets, or in this case, special diagnosis. This is Ali the aardvark. Keepers noticed she was sort of weeping from one eye, and they weren't sure what it was.
We tried many different treatment options. It would wax and wane and get a bit better, but end up always coming back. And then eventually in one of our last radiographs, x-rays, we actually saw some lucency or some moth-eaten appearances to some of the bones underneath her eye, which made us think that maybe there's a connection between that and what she has going on, which then led us down that whole path of can we get some different diagnostics to try to see if we can make sure that's actually what it is.
So we went to our friends at Children's, who helped us figure it out.
We were contacted by the zoo, and they know that we have some imaging capabilities that are very unique to the area, and we specifically have an imaging center that it's separate from our clinical imaging area where we image all of our clinical patients, but we have a separate radiology imaging area that we're able to perform various kinds of imaging, plain X-ray, CAT scan X-ray, MRI scans, ultrasound, and this was a perfect opportunity for us to be a good neighbor. Different shape, different bones, but essentially from our radiology training, we're able to use that knowledge of anatomy and apply it to an aardvark. With our imaging capabilities, specifically this cone beam CT, we were able to see three-dimensionally the Ali's anatomy. Typically with plain X-ray imaging, you can just see 2 dimensions. And with CT or CAT scan imaging, you can create 3-dimensional images and not only see the bones, but also see the soft tissues and look for pockets of infection called abscesses. And that's preliminarily what we're seeing here on these initial images.
She may have an infection at the base of her teeth. Aardvarks notoriously have issues with teeth. Over time, we're not quite sure why. So we think that's the reason why. She basically has an infection there, but it's really hard for us to diagnose that. And the infection is tending to go up by her eye versus down through her mouth.
I think everybody involved felt good about helping an animal back to health. And this neighbor-helping-neighbor relationship is very important to us. So we certainly want to thank our good friends at Cincinnati Children's.